Did you know that 1 in 3 people will be diagnosed with cancer at some point in their lives? That's a staggering statistic, isn't it? And what's even more troubling is the fact that many people only discover their cancer when it's too late, when the disease has already spread. However, the truth is, there are subtle signs your body may be giving you long before the cancer reaches its later stages. If caught early, the survival rates for many types of cancer can be over 90%. But if it's found in later stages, survival rates can drop dramatically, sometimes to as low as 20%. In this video, I'm going to walk you through 7 early warning signs of cancer, signs that many of us might overlook. These are not the obvious symptoms you've probably heard about, like lumps or drastic weight loss. No, these are small, sneaky changes in your body that many people miss. However, noticing them early could truly save your life. Let's dive into the details, but don't worry, I'm not here to scare you. This is all about staying informed and empowering you to take action. Stick with me until the end, as I'll also share a personal story and offer some key advice on what to do if you notice these warning signs. 1. Persistent heartburn. A subtle warning of esophageal cancer. We've all experienced heartburn at some point, maybe after a spicy meal or a heavy dinner. But what happens when this sensation doesn't go away? If you have persistent heartburn that lasts for weeks or even months, it could be a sign of something more serious, like esophageal cancer. How does this happen? Well, chronic acid reflux or GERD, gastroesophageal reflux disease, can gradually damage the lining of the esophagus. Over time, this can lead to a condition called Barrett's esophagus, which significantly increases the risk of cancer. It's not just the discomfort of heartburn that should concern you. If it's accompanied by difficulty swallowing or unexplained weight loss, those are red flags. Personal insight. I had a patient once, a middle-aged man, who thought his recurring heartburn was just a result of his love for spicy food. However, when it persisted and started to interfere with his daily activities, he got an endoscopy. It turned out that the acid reflux had caused severe damage to the lining of his esophagus. Thanks to his early action, he caught it before it became too advanced. His treatment was successful, and today, he's living a healthy life. Takeaway. Persistent heartburn is not something to ignore. If it's affecting your daily routine or accompanied by difficulty swallowing, don't wait. Consult with a healthcare professional immediately. 2. Unexplained night sweats. More than just a nuisance, sweating at night is common. Maybe your room is too warm, or you've just had a stressful day. But what about when the sweating is so intense that you wake up drenched in sweat and need to change your sheets multiple times? That's something to pay attention to. Persistent, soaking night sweats could be a sign of lymphoma, a type of cancer that affects the lymphatic system. These night sweats often don't occur in isolation. They're usually accompanied by fever, unexplained weight loss, and a feeling of constant fatigue, known as B symptoms in medical terms. Personal insight. I remember a case where a woman in her 30s began experiencing extreme night sweats, which she initially brushed off as stress or hormonal imbalances. But when she also started feeling unusually tired and noticed unexplained weight loss, she decided to see a doctor. It turned out she had a form of lymphoma. Thanks to early intervention, she is now in remission and doing well. Takeaway. If your night sweats are accompanied by other symptoms like fever, weight loss, or fatigue, don't brush them off. Early detection is crucial for conditions like lymphoma. 3. Jaundice. A silent indicator of liver or pancreatic cancer. Have you ever noticed a yellowish tint to your skin or the whites of your eyes? This condition, called jaundice, can be a sign that something's wrong inside your body, often pointing to liver or pancreatic cancer. Jaundice happens when the liver can't process a substance called bilirubin properly, usually due to a blockage in the bile ducts. The symptoms that accompany jaundice include dark urine, light-colored stools, and pain in the upper abdomen. Personal insight. A close friend of mine once experienced jaundice. He thought it was simply a digestive issue at first. However, when he went to the doctor, it was discovered that his bile ducts were blocked due to a tumor in his pancreas. Fortunately, the cancer was caught early, and he received treatment that made all the difference. Takeaway. Jaundice isn't something to dismiss. If you notice the yellowing of your skin or eyes, especially without an obvious explanation, consult a doctor immediately. 4. Persistent bone pain. Not just aging or injury, occasional aches and pains are part of life, but when it comes to bone pain, especially if it's persistent and worsening over time, this could be a red flag. It's not uncommon for cancer to spread to the bones, or even originate there, as in the case of osteosarcoma, a type of bone cancer. What makes bone pain concerning is when it feels deep, persistent, and doesn't respond to typical painkillers. Additionally, if the pain is accompanied by swelling, fractures, or unusual symptoms, it's time to take it seriously. Personal insight. I had a patient in their late 40s who initially thought they were just getting older and experiencing normal joint aches. However, the pain was severe, particularly at night. After further investigation, it was discovered that the pain was caused by a metastasis from an underlying cancer. The early detection allowed for a tailored treatment plan, and while the road was tough, the results were life-changing. Takeaway. Don't ignore persistent bone pain, especially if it worsens over time or comes with swelling. Early detection of bone cancer or metastasis can make a huge difference. 5. Unexplained rash. It might be more than skin deep. Most of us get rashes from time to time. But have you ever noticed a rash that doesn't fade or go away? A rash that appears as petechia, tiny red or purple spots that don't blanch when pressed. These could be a sign of leukemia, which affects the blood and bone marrow. In leukemia, your body's ability to produce healthy blood cells is compromised, leading to issues like petechia, bruising, and excessive bleeding. Personal insight. I once treated a young woman who developed unusual rashes on her arms. She thought it was an allergic reaction to something she ate, but when the rash didn't go away, and she started bruising easily, we took a deeper look. It turned out she had leukemia. Early detection led to her undergoing chemotherapy, which ultimately put her into remission. Takeaway. Unexplained rashes, particularly those that don't fade or are accompanied by bruising, should never be ignored. Early action can make a world of difference. 6. Persistent fever. Your body's cry for help. Fever is often a sign that your body is fighting an infection. But what if the fever doesn't go away? What if it keeps coming back without a clear cause? Persistent or recurring fever could indicate blood cancers, like leukemia or lymphoma. These fevers are often cyclical, meaning they come and go, and they won't respond to typical treatments like antibiotics. If you have a fever lasting more than 2 weeks, especially with symptoms like night sweats and fatigue, it's time to see a doctor. Personal insight. I remember a case where a patient kept running a low-grade fever for weeks, and doctors couldn't pinpoint the cause. Finally, after a series of tests, it was discovered that it was leukemia. Her persistence in seeking a diagnosis saved her life. Takeaway. Persistent fever, especially when accompanied by other symptoms, should never be dismissed. Always get it checked out. 7. Unusual fingernail marks. A sign of skin cancer? Did you know your fingernails can reveal more about your health than you think? One of the most overlooked signs of subungual melanoma, a rare form of skin cancer, is a dark streak running under the nail. This doesn't disappear as the nail grows out like a bruise would. If you notice a dark streak that doesn't fade, or a change in the shape or color of the nail, don't ignore it. Early detection of subungual melanoma can save your life. Takeaway. Pay attention to any changes in your nails. If you notice unusual marks that don't fade, consult a dermatologist. Your body sends you subtle signals when something's wrong, but many people overlook these early signs, thinking they're nothing to worry about. However, paying attention to these subtle changes, like persistent bone pain, unexplained night sweats, or changes in your nails, could save your life. If you notice any of these symptoms, don't wait. Early detection is key. It might not be cancer, but it could be something just as serious. Always consult your doctor and get checked out. Your health is worth it. Thank you for watching. If you found this information helpful, please give it a thumbs up, share it with someone you care about, and subscribe to our channel for more life-saving content. Remember, staying informed and proactive about your health can make all the difference.